Is there certain phrases or things you like to say? Because I know you have some experience with that as well.
That's kind of difficult because that's like a case by case basis. So let's say there's an elderly person with a neurological complaint. You've got to have a lot in there to say that it is this, it isn't this, this is why I did this. So it's very difficult to say, like, just generically add these elements and don't add others. But to protect yourself medico-legally, you want to document what was done and you want to do what was documented. And I see a ton of cases where I'm reviewing charts for peer review or for legal consulting or something, and I'll go back to the ankle sprain thing, and they've got cranial nerves grossly intact, and they've got pupils equal and reactive. That automatically makes you a liar if, like, the attorney says, did you actually, for this ankle sprain, take the light and look at someone's pupils? And the answer, if you have it documented, should be yes. And if the answer is yes, why? So document what was done and do what is documented. And also, another thing is, more isn't always better. So being concise but very accurate and communicating very clearly is so much better than having 6 paragraphs in your medical decision-making thing that just ramble on and go all over the place. So those are to like say specific things. Like, there's very specific things about abdominal pain that I say in my chart to protect medical legal, but I would honestly have to go through like each complaint and each diagnosis to really give accurate things.
Right. Yeah, I see a lot of newer APPs, I think, doing more rather than less in the chart, and kind of the rambling, like a lot of irrelevant stuff that probably doesn't protect them as much as they think, as opposed to just focusing on what the chief complaint is and saying why the patient's safe to go home.